Well, today we're here in the exam room with Joshua Ahern. Josh, thanks so much for coming out. I am so excited to have you here.
Absolutely.
Josh is with Infiniti Medical, and you've got a product that is just barely released. It's just weeks that this is out.
Brand spanking new.
And the product, as I understand it, is something that's going to allow us to see the inside of a pet. Mm-hmm. It's going to keep us maybe in some cases from actually needing endoscopy or more invasive type procedures. Is that right?
Absolutely.
Okay.
And yeah, you nailed it. You hit the nail on the head. And so that was really one of the main goals when Infiniti Medical was developing this product, is something that was minimally invasive, that would give you detailed images of the GI tract from start to finish, all at simply by administering a capsule. And
well, that's great. A capsule. Show us what you're talking about.
Absolutely.
This is really cool. I saw a photograph of this earlier, and I couldn't believe how tiny this thing was.
So this is the AllyCam, and that stands for Ambulatory Light-Based Imaging System. So as you can see, it's probably about the size of a vitamin tablet.
Right.
And so I have a really large hand, so I'm going to give it to you to kind of give it so everyone has a better scope of how small that thing is.
Like a big amoxicillin capsule or something like that.
Exactly.
But this has cameras in it. Is
It
that
does.
right?
It does. So it has 4 high-definition resolution cameras that line at 360 degrees around the camera. So you're going to get that 360-degree view with those cameras. It also has 17 LED lights that are all lined around the camera too as well, to make sure you get a crisp, clean image of the entire GI tract as it's passing through.
This is going to be literally something that the dog is given just like any other antibiotic or vitamin capsule.
Yes, exactly.
And then the process starts.
Exactly. So what we recommend is just to fast the dog for about 24 hours if possible. Obviously, you can't wrap it in peanut butter or bacon or anything like that.
For obvious reasons.
We need the view.
Cameras.
Exactly. But each one of these cameras are taking 20 images per second. And so the reason for that is you want to get, obviously, you don't want to miss anything in the GI tract. And then we have the ability to compile it into a video. So that's great for the doctors, but then, the owners want to see what's going on too as well.
So you can have a video image as this travels through the whole intestinal tract, start to finish.
Exactly. And it's also some really smart technology. If it gets lodged anywhere in the GI tract, it'll automatically shut down so it doesn't take redundant images. And then obviously, if it for some reason does not move, let's say within a day or two, well, we know what's going on. There's some large obstruction or some other issue that's going on with the dog.
And you're able to see right where that is.
Yeah, it's radio opaque too as well, if you need to find it. So as it passes throughout the entire GI tract, it has about 18 hours of feed. Then, like we talked about earlier, there's no easy way to retrieve this or to.
Yeah, I was going to say, now how do you collect this when you're through?
Exactly. So it's simple as just taking a little baggie around your hand, just squeezing in the feces to find it. In most cases, the LED lights are still blinking, so kind of like a little search beacon that'll help you find it.
Like a little lighthouse there.
Exactly. So after it's recovered, then we also supply the owner with a little vial like this.
Drop that right in there.
Please, please rinse it off, maybe with some soap and water, just to make sure it's nice and clean. Then we also supply a prepaid FedEx envelope that is given to the owners too as well. And so once it's plopped in there, it's all ready to ship and go. And
send it off.
Exactly. So then it goes off to a team of board-certified internists that makes up our team with Infiniti. Then that's when they start reading the report. They work, obviously with you to find out what was the dog's symptoms previously, what type of medications have they been taking to really help you identify what's going on with this dog.
And then this is actually the sort of report that you get.
Exactly.
So it's got information about your pet, the history. Actually, to me, they're beautiful images of what things look like on the inside. And
some may disagree with you, but obviously they're useful. That's for sure.
Yes, very, very useful. So the kinds of things we're going to be able to find using this technology would be like stomach ulcers, intestinal ulcers,
parasites. In type of cancers. There's even some. I mean, at the end of the day, I've had this question a lot. You obviously can't biopsy with this, so where does this fit in? This is not meant to replace those situations where you absolutely have to have a biopsy and you have to.
But it can let you know if you really, in fact, need one.
Exactly, and at the same time as well. I mean, there's even with this case that you're holding, it was an IBD case, and so you can't 100%
which is inflammatory bowel disease.
Right.
An inflammatory condition that really, if you know you have it, it can be pretty simple to treat in some cases.
Exactly, without having to put the dog under anesthesia, without having to open the dog up whatsoever, all by simply administering this capsule, letting them go home.
And how great to come away with that diagnosis versus a cancer diagnosis, and all non-invasively.
Absolutely.
That's great.
Absolutely, absolutely.
Well, this is really exciting technology, and this is a veterinary-only sort of product.
Yes,
I think
yes.
it'll probably be not long before we see it on the human side.
And we talked about earlier, I'm not going to ask you to swallow one, for everyone at home or anything like that. So.
Right. Well, very good. Well, this is exciting, and if you do have questions about the AllyCam, you can definitely call us here at Eastlake at 214-342-3100, or as always, you can log on to our contact information below and reach us that way. And Josh, thank you so much.
Oh, thank you.
So honored to see this firsthand right as it's become available. Really good stuff.
Oh, I really appreciate it. Thank you so much for the time.
Thank you. And we'll be back with more in just a moment. And welcome back to the Eastlake Pet Talk podcast. Today's episode is actually shot right here at Eastlake versus in our studio space, and we're talking about a new respiratory issue with dogs. And in fact, last week we talked a lot about an outbreak of kennel cough or bordetella in the Chicago area, but now it turns out that this respiratory outbreak is actually including the dog flu. So more reports have come out of the Chicago area showing that many of these dogs with respiratory issues actually truly have dog flu. Dog flu is typically associated with a honking cough, fever, and depression, and initially it can be very difficult to differentiate from other respiratory diseases. At the first sign of a cough, pet owners should see their pet's doctor to avoid more serious complications like pneumonia. In Chicago, so far, 5 deaths from canine flu have been reported. The good news is dog flu can be prevented with vaccination. Dogs that travel or live social lifestyles are especially good candidates for the vaccine. So ask your pet's doctor about preventing this disease. And we're also especially pleased to be a part of a program that offers free respiratory testing and a vaccine guarantee. For more information about the dog flu, you can log on or call us at the information posted below, or for more immediate assistance, you can call us at the main Eastlake office number at 214-342-3100. But besides respiratory diseases, there's a lot of allergies going on this time of year, and I know we talked about that a little bit last week, but this is definitely the time when we see itchy, scratchy dogs. And the things that cause allergies and itchy, scratchy skin for our dog friends are usually the same sort of things that cause us to cough and sneeze and wheeze. In essence, it's a hay fever of the skin that we see with dogs. So things like pollens, dusts, and danders are really the offending culprits for that itchy, scratchy skin. And the good news is we have a lot of choices between medicated shampoos that help relieve the itch to a new medication called Apoquel. And in addition, for the cases that are more advanced, sometimes allergy testing and allergy shots are your answer. So for more information about allergies, we welcome your questions, and as we go through the spring, we're going to be talking a lot more about this topic. And we'll be back with more next week, same time, same place, on the Eastlake Pet Talk podcast. Thanks so much. Well, before I let you go, I have to call you back just to take a look at these 4 little angels. These are our new little pets of the week. These 4 little sweet kittens were just brought in from an apartment complex. They were born from a feral mother that couldn't be handled, and the kittens had just reached right about the 6 week of age point, and the apartment workers where they were found saw that they could capture the kitties and bring them in. So they've all had a nice full belly full of food, and they're happy and content and all nestled up, and the next step becomes capturing mom to help her be spayed. But we've got 4 little angels here. We've got Alex, Alexi, Lex, and Alexis, and it doesn't get much cuter than this. And let's see if we can get you a closer look at these angels. And they are just beautiful. So thanks so much, and we'll see you back same time, same place next week. Have a great week.